Efficiency, of course. In image interpretation, it's brilliant. It gives a diagnosis which you don't even think of amongst the differentials as a doctor. Triaging systems, reducing human error, a real-time reporting. So it is very quick. Now, the management says that, okay, it has 20 radiologists, and they are reporting about, say, 300 CT scans in a week. AI will do about 1,000 CT scans. So the management will like the AI, or will they like the radiologists? It's not rocket science, but there's a human element, isn't it? We can't trust entirely AI. So there's a human element. That's why we need human beings. So it's going to help us. And you can see that, again, improved accuracy, efficiency, detection, prevention, screening tests. Nowadays in UK, most of the screening programs are done with AI. Enhanced patient experience. The patients are feeling very happy. They say that the AI was listening to me. It was very empathetic. It listened to all my problems. The doctors don't have patience. They don't listen to us properly. This is a survey from UK. I'm not exaggerating. So the patients are quite happy. But the survey also says very clearly that they would be happy if a doctor is behind it rather than leaving everything to AI. Cost effectiveness. Of course, because employing a radiology consultant in the UK costs them £100,000 per annum, whereas AI is a one-time investment, so it's cost-cutting as well. So here you can see algorithms can be different for different softwares, black box problems, people losing jobs. Again, everyone knows a radiologist who doesn't want to learn AI is going to lose his job compared to a radiologist who embraces AI. So please remember that. I'm not sure how many radiologists are here, but it also applies to all other specialties. Over-reliance, but one thing, let's not over-rely on automation. We will become zombies. Since we lost the regular clock, the analog clock, we stopped now calculating the time, isn't it? Because everything is ready-made. We tell you, say 11:05.06 seconds. So I think we don't want to lose our cognitive skills. And data harvesting without consent. So again, there's a problem, there's a downside where you're not involving the patient. You're doing things behind the patient's back, which the patients can object, confidentiality issues, leakage of data, information governance. So that is the downside where UK, US are working very hard. And that's why, one of the reasons why we're not able to implement it widely. So these are the areas where we still don't have clear answers. Ghost AI authorship in medical journals. Some of the medical journals are done on ChatGPT, which is dangerous. That means it's not original work. And military surveillance. So it's also like there's a crossover between medicine and military because they use all the high-resolution cameras for both, especially radiology. And then AI systems can hallucinate. They can create abnormalities. You have to be careful. So unspoken, and some of the shocking truths which some of my engineering colleagues will not like, but I think I'm here to tell the truth. But I'm not here to blame anyone. I'm here to tell the truth. And we have gathered today to look at the upside and the downside of AI and see what should we take from AI and what we should be careful about, what we should avoid, and what probably is the area where we have to work more. So these are the areas: data privacy, bias, fairness, regulatory compliance, clinical trust, integration, how to integrate into the clinical workflow. How are you able to integrate it into clinical? Say, for example, if I'm reporting 50 chest x-rays, how are you going to integrate it into the patient case notes? How are you going to communicate it to the doctor? So these are the other areas where there's a lot of work going on at the moment. Now, again, if you see there's so many people involved when it comes, when there is an issue with adoption. So there are lots of issues, and the lawyers are also sitting there like hawks, waiting for a problem to happen. The other big problem, we don't have an answer, is AI makes a mistake, who will be held responsible? We don't have an answer. I'm also going to I'll be the moderator of the next panel discussion, which is going to be quite interesting. I have some very learned experts with me. That'll be the next session. So please stay here, because this talk, I thought it will be good as a prelude as to what's coming next. Yeah? Misdiagnosis due to algorithmic bias. It's not due to anyone's mistake. Rising unemployment. Let's not blame everything, all unemployment on AI. Let's not do that. And loss of agency. Surveillance health techs embedded in public systems. So sometimes it can get embedded in the public system, which is not a good idea. We need to keep it separate. And here you can see what is the trajectory. Where is this heading? Where we will be in 2 years or 5 years' time from now? Look, this is what's going to happen. It will be an integrated partner. And my robotic surgeon, Dr. Shinababu is there. I have so many other learned surgeons with me here today. Global healthcare access, which is very good. And personalized medicine, like my genetic makeup is made up, and then the oncologist decides which is the best chemotherapy for me. The same drug, which is very effective for me, may not be effective for the other doctor, for the other patient. So AI in preventive healthcare. So also predicting. So prevention is better than cure, so there's a lot of emphasis on that as well. And you can see here precision medicine. This is what AI is doing a lot in health. And we need transparent systems, ethical training, strong regulations, and continuous human oversight. So these are the areas where there's a lot of work being done. That's why you see a lot of people are talking about AI all over the world, but not many hospitals are practicing. Why? Because of these issues. And you can see the future of radiology is coexistence and not replacing. And you've seen that in AI. IBM Watson, they did a study. And of course, I'm not promoting any product, but just letting you know that detection of cancers, bleeds, stroke, everything. Nowadays in London, in my hospital, we are doing everything with AI, diagnosing stroke, cancers, everything. Robotic surgery, yes, we have robotic surgery, which is all completely AI controlled. Drug development. So I'm going to stop there because I'm going to continue anyway the panel discussion, and I'm acutely aware of the time. So we will have a chat. Thank you.